I'm going to talk a little bit about setting a foundation for calf success. And last week you had Dr. Jennifer Van Oss, our extension dairy well-being specialist, lay out some other management practices when it comes to paired housing. But when we think about calf success, it's really about animal welfare and animal husbandry, that we have the inputs related to housing, management, and handling that really impacts the animal's welfare, health, growth, and development. And depending on those inputs, whether or not we'll have a poor outcome or a good outcome. And ideally, we want a productive, growing calf that will eventually go into a productive milk cow 2 years down the line. Now, last week, Jennifer had shared with you our starter guide to pairing dairy calves that she developed, and I helped collaborate with her on that. Two heads are better than one. And she had addressed a couple of the topics last week, including the fuss about pair housing, group strategies, and feeding practices, as well as reducing cross-sucking, which is a big question amongst many individuals. So today I'm going to kind of take off from where she left off and talk about calf health benchmarks, hygiene practices, housing considerations, and disbudding considerations for the next half hour. So when we think about calf health benchmark, really we don't know how well we're doing with our calf management program if we're not measuring what we're doing and analyzing that data. But calf health is really a huge foundation to having a productive growing calf who will be a productive member of the milking herd later down the road. We do know, based on research over the last several years, even as early in the 80s, that illness does affect the performance and the later lactation of those animals. We have diarrhea and respiratory, which are the two #1 causes of disease, as well as mortality in our newborn calves. And that we can see that when calves have diarrhea, it increases their chances of leaving the herd by 2.5 times. And can increase their chance of calving after 900 days by almost 3 times. And that's because with diarrhea, we're having issues, concerns, damage to the stomach lining, absorption issue. They may be off feed, which kind of lags them behind on growth. When we look at respiratory disease, that we can increase their age at calving by 6 months of age, possibly, if they calve at all. And I think as we look back, as you're managing your calves, and you think about those calves that you've kept and were chronic respiratory animals, you know, how productive were they? Were they late bloomers? Were they late to breed? I think a lot of us can recognize that when we have milk cows that just seem not to take off, are not producing to their genetic potential, you kind of look back and think, oh, I remember that one. That one's I treated for respiratory. So we really need some good lungs so that animal can be able to produce for you. And so even with some of the more recent research with Dr. Terry Olivet, we do know respiratory in those young calves is huge and should be addressed very early and treated early, or made decisions quickly, whether we're going to continue treatment or cut our losses, because the fact that to raise our heifers right now, and has been for quite some time, costs more than actually purchasing them. And then we compound that with the treatment cost. Is she going to be able to be in the herd long enough to recoup not only her rearing costs, but also some of those treatment costs if she's a chronic respiratory animal? A little bit on transfer of passive immunity. Most of us really call this in the past passive transfer, but it's really passive immunity and transferring that from the dam to the offspring through the colostrum. And Jason Lombard, a veterinarian with the USDA, out of Colorado Springs, had looked at the NAMS data, which goes out to all of the dairy herds across the country at the National Animal Health Monitoring System, and kind of looked at the data, what people were reporting, came up with these numbers. When we talk about passive immunity, you know, what is good? What is fair? And we've always talked about we wanted it over a certain number, IgG levels over 25 grams per liter, a Rick's spectrometer over level over 9.4%, total serum protein over 6.2 grams per deciliter. Generally, you don't know about the passive immunity after the fact with the total protein. But if you go further down and you're analyzing your colostrum management, if we're looking at levels of less than 10 grams per deciliter, you're looking at less than 5.1 grams deciliter of blood total, serum total proteins, then we know we need to reevaluate the calf management program. So really, the passive immunity is huge. And to me, it's free. It's colostrum from the cows, providing good quality colostrum. It's an ounce of prevention and making sure it gets into the calf to have those excellent levels. And one way to start monitoring your calf management program is to look at passive immunity. And, how good are you doing? Ideally, we want 40% of the calves to fall in this excellent category of passive immunity. 30% of those calves will be good. 20% of your calves will be fair, and less than 10 of your calves should have poor passive immunity. You can do everything correctly in harvesting, storing, collecting, feeding, and managing colostrum, but biologically, sometimes those immunoglobulins don't get absorbed, or they're not of good quality from the cow. And that's really out of our control. But if we can do everything else well when we're doing colostrum management for the young calves, ideally, we want 70% or more of those calves to fall in that excellent or good range for passive immunity. Calf morbidity or calf disease rate is something that we should really be measuring. And I know it's a hard number to grasp when I work with my dairy farmers. A lot of that is testimonial or eyeball metrics, as Dr. Pat Hoffman, our retired dairy replacement specialist, to say that we're looking and using our eyes to judge the rate. But goal-wise, we want clinical pneumonias to be less than 10% and clinical scours less than 15%. So again, this is where they have visible signs of disease. And to calculate that morbidity rate at any given time, calculate the number of calves treated divided by the number of calves fed to get your morbidity rate. Mortality or calf death, we strive ideally to have no death losses, but we're going to have some. But if we can achieve 2% death loss in those young newborn calves, we're really excelling in our calf management program. And again, this is a number that really farms should have at hand, because you can measure the success of your calf management program. And if you can't measure it, how can you make changes? How can you look at the changes you do make and how effective they are if you're trying to adapt a new practice or a new management to address some of the issues on the farm when it comes to calf mortality or even calf morbidity? So here we want to take the number of calves that we lost from birth to weaning. And generally, I would say at least 24 hours of age to weaning, because those before 24 hours, generally that's death due to trauma or some other things in utero related to in utero or the calving process. But from birth to weaning, and the number of calves born in that same time frame. So you can look at mortality on a monthly basis, larger operations on a weekly basis, maybe it's a quarterly basis or a yearly basis, but it's really good to look at these numbers to really see effectively how your change is occurring, or even just to get a handle of what the situation is if you're having mortality or morbidity issues on the farm. And how do you compare? So the DCHA Gold Standards 3, and then this is a chart I adapted from Zoetis Calf and Heifer Assessment. But ideally, looking at less than 60 days, so we're looking at that pre-wean calf, our morbidity rate, we like to be at less than 15%. It comes to respiratory. And then scours, we'd like to have less than 25%. Anything above that is then we're needing to take some action. Mortality, first, they have 48 hours, ideally less than 6%, and then 24 hours to 60 days, or at the time of weaning, is less than 5%. But I think we do such a great job as an industry here in Wisconsin that we can easily get to 2%, recognizing that whether it's with the mortality, is it caused by management or lack of management, or is it more biological because of lack of colostrum absorption? with the immunoglobulins, or is it something else that's happening biologically? So again, using these numbers, having these averages as a benchmark for your operation to achieve, also a way to measure how well you're doing or not doing in your calf management program. Finally, talking about benchmarks for the calf management, really calf productivity. I'm not going to get into this too much, but again, are you doubling your birth weight by weaning, or is it 55 days? And you really don't know unless you measure it. Again, it's not eyeball metrics. It's measuring whether it's a tape or whether it is a scale that you invest in. And we want to see some growth in those animals, 4 to 5 inches in height. So again, going through and measuring how well you're doing is key. And when we say, we also want to look at not only weight, but height, because weight can be deceiving. An animal may be, or a height could be deceiving, because we may have a shorter statured animal that's heavier in weight compared to a larger, lankier, taller one. So again, we do know, based on much research done, especially out of Cornell and Penn State, that we do see lactation performance productivity and increases when we have those calves growing from the get-go and thriving through the pre-weaned stage of their life. Next, we're going to talk about hygiene practices. And when we think about hygiene practices, really think about the biofilms, which are our biological foe. What these are is a microbial growth on any solid surface that you can see or maybe not even see. It's just a thin, small film. And this film contains bacteria, viruses, and protozoa. And they feed off what is a perfect medium of carbohydrates and proteins? Milk. And so they will feed off of this and be a source of pathogens to our young calves. And a lot of times they will form when we don't have the proper cleaning protocols in place to remove the residue, or there's imperfections in the feeding equipment with the buckets that we're using, where there's maybe scratches or grooves in them, and that the bacteria, the pathogen protozoa, can actually populate in those areas because we still have residue in those cracks. So it's a very small film, but it does cause havoc. And even in this example, Sarah Mills Lloyd, who was an extension out of Oconto County agent several years ago, we took off of this milker, the rubber ring, which was kind of a pain to take off, but we got it off. You could see this residue that was not getting cleaned through normal cleaning practices. So every nook and cranny needs to be cleaned when we're talking about especially feeding our newborn calves. And with buckets that have scratches, at some point they need to be retired. They may be perfectly good to like haul water in, but maybe they're no longer used as milk buckets. So thinking of where your sources of potential pathogen load can be and reducing those are key, as well as a cleaning protocol to reduce our biofilms. Dr. Don Sockett out of our Wisconsin Veterinary Diagnostic Laboratory recommends this cleaning protocol. Very simple when it comes to doing washing, cleaning, and sanitizing any of our feeding equipment. Rinsing with lukewarm water, soaking in hot water with a % chlorinated alkaline detergent, washing vigorously with a brush, rinsing with cold water, rinse with acidic solution, and then allow to dry, air dry. And we like to have them dry at least, for 2 hours in an area where they're not collecting moisture, but allowed to dry and be able to sanitize on their own. A very simple protocol to follow. Basically, it's the same protocol for cleaning a milk line. So it's the same equipment we use to clean the milk line after milking. It's pretty much the same we want to do for feeding the clean feeding equipment, because we're cleaning that same biofilm in both situations. One of the things, and when it comes to cleaning and sanitizing, is using the right disinfectant for the job. And depending on the type of pathogen, if it's a mycoplasma, is it our staph and strep species? Is it E. coli? Is it Pseudomonas? Is it foot-and-mouth disease, a fungal or coccidia? Different types of disinfectants are more prone to killing or disinfecting that pathogen. So we're looking at the alcohols, which are good for mycoplasmas, the staph and streps, gram negatives and Pseudomonas, but not good for those like foot and mouth disease or the coccidias. We're looking at products like One Stroke and Check-Tol, again, similar to alcohol in achieving disinfecting those mycoplasmas, staph and strep species, gram negatives, and the Pseudomonas. Iodine is good for the mycoplasmas as well as bleach, but has some effect when it comes to the other types of pathogens. But really, there's not one good disinfectant for coccidia, as you can see, except for One Stroke or Check-Tol, which has some effectiveness to it. The red here highlights there's really no activity using that type of disinfectant on that type of pathogen. So we're looking at like Rho-Kal-D is not good for fungal or coccidia at all. So really making an investment in the right disinfectant for the job that you have and understanding the type of pathogens that you're dealing with on the farm will help you combat those pathogens and selecting the right disinfectant for the job. How clean is clean? A good investment here, $1,000 or so, are these ATP meters, which we've seen throughout the industry for quite some while. And really what ATP does is measure living cells. Bacteria, biofilm, protozoa, they're all living cells. So what we're measuring is the activity of the adenosine triphosphates. And they can help us kind of get an idea of the bacterial load on a feeding equipment or other equipment we use with calves, as well as what type of biofilm activity. And to use the ATP meter, we want to be able to really test any surface that really comes in contact with the calf. The sides of our calf pens, the feeding equipment, the esophageal tubes, anything that can introduce pathogens to our newborn calf. Is remember, our newborn calf is born as a naive, zero immune system animal, and it is through us that we build that immune system through passive immunity. And so to help that passive immunity begin to take hold in the calf, we really need to reduce that pathogen load. Many of the questions we've had in the past about benchmarking, what does this number tell me? And in the past, we would tell individuals, well, swab the product while it's dirty and swab it again once it's clean to give you an idea of how much you're reducing that pathogen load or those living cells on that surface. If you're getting a big difference between the two, we're actually getting it clean. But really, how clean is clean? So Dr. Don Sockett at the 2019 European Calf Conference in Berlin had presented this table on some guidelines or benchmarks to assess cleanliness of the calf feeding equipment, and gives us guidelines for water, calf water buckets, grain buckets, calf pens, and livestock trailers for those that may have to haul their animals to a custom raiser. And our goal, which a lot of people have been asking, are these units in relative light unit. Less than 5 for water, ideally that's clean coming out of the faucet, and our calf water buckets less than 100. Because remember, we do have some contamination, the calf drinking all the time, saliva. Our calf grain buckets less than 50, because we can clean those more often. Acceptable if we can get less than 10 relative light units, less than 200 for our water buckets, or less than 100 for our grain buckets. If we're having high numbers, and I've seen high numbers as high as thousands, we do know that we're not getting it clean, or it needs to be cleaned or disinfected a different way. So using some of these benchmarks, maybe these are not realistic goals for your farm, but again, maybe even just benchmarking what is clean for your farm and what is dirty for your farm when it comes to calf feeding equipment or used feeding equipment, and then be able to look at the difference can be also a benchmark. So for example, here with calf pens and livestock trailers, as we know, that is always exposed to manure, saliva, and lots of pathogen growth. So here in these examples, that if we can see a reduction of at least 90% in the relative light units at before and after cleaning, you're really achieving the goal of cleaning and disinfecting. So in these cases, especially calf pens and livestock trailers, you would test before they were clean and then wait 20 to 30 minutes, clean them, wait 20 to 30 minutes, and then retest for the ATP meter and look for a reduction. Also in calf management, we're going to talk about benchmarks is our Holstein calf sleeping patterns. As you know, our calves like to sleep in our University of Wisconsin. We know about over 50% of the day they're laying down, they're exposed to the ground or the surface they're laying on, and 100% at night. They do spend a lot of time in their environment and their bodies with exposure to potential pathogens. And we think about ideal bedding. Ideal bedding not only soaks up that liquid from used milk or water, but also urine. It provides insulation for our newborn calves, especially this time of year during the cold, and allows nesting so that they can insulate and warm themselves. A good base also provides insulation or factor from level of bedding that separates the calf from the liquid that has soaked down, as well as potential pathogen growth underneath the base. And it also provides a shock absorption as well for those calves. So we definitely want a good base. And what is a good base? We see that 20 to 25 pounds of bedding per calf, at least 12 inches or depth or more, and we're talking more of the winter housing, is key. And adding bedding 2 to 3 pounds per day to the pen, or at least per calf if in group housing, because we want to maintain that depth. We want to maintain the airiness, the fluffiness of that bedding, especially this time of year for nesting. And again, we want to give them a barrier between what has been absorbed through the bedding and where they are actually laying down. Which bedding is best for you? This is quite an old chart, but we do know that different bedding materials absorb moisture at different rates. And whatever works best for you, what's accessible and what is cost effective is key. Soybean stalks, corn stover, wood shavings, chips, sawdust, sand in the summer. But what the key is, it's really about the amount that is used. That's more specific than the material used. We're trying to provide a layer, a barrier to protect that calf from pathogens, a barrier to prevent them from the cold ground, and also as a shock absorption. So again, it's amount that's used. And in this case, more is better. And I realize that means more bedding to clean out at the end of the day or the end of the week, but more is better to give them that opportunity. Looking at us, would we rather have a nice soft bed or a hard floor to lay, a cold floor to lay on? Even laying on air mattresses, because we're laying on the air mattress, a lot of that room cold air is acclimated in that air mattress. And many times I have to put a blanket underneath me on the air mattress to help provide that barrier from cold. So again, thinking about what we can do to provide that calf the best living environment that we can is key. And finally, the knee test, easy to do. Again, another monitoring system for benchmarking, but you can drop to your knee or lay down on your knee, or gently place your knee down. And what you're going to do is rock your knee back and forth to see if the pressure is comfortable. Is there enough bedding there? Or is it when you rock back and forth, does the bedding kind of separate and you're getting to the base, whether it's gravel or the lime screenings or whatever you have under those calves? And also, is it clean? Or dry? It may look clean and dry, but really it might not be under that surface. And again, as the calf is laying down, that's again closer to the potential dampness and pathogens that that calf can have exposure to in the bedding. So a knee test is a very simple way, especially with their employees. If they're having a hard time gauging how much bedding, if there's enough, this is a great opportunity for them to test this out, especially in those fall and spring weather when we're not thinking as much bedding is needed. Next, we'll just talk a little bit about housing considerations. I didn't want to dwell on this too terribly much, but again, we're looking at the Dairy Calf Heifer Association gold standards, and shelter is critical for any animal of any age. And when we're looking at our wet calves, 24 hours to 2 months of age, we want good air quality, 100 cubic feet of movement in the hot weather and 15 cubic feet per minute of during cold weather. And that is to get fresh air in. We are ventilating, not circulating. And the difference between that is ventilating brings in fresh air from the outside, while circulating only moves the current air and not replacing it with fresh air within the barn or facility. And during the cold weather, we want to minimize draft. And what is draft? A good way to tell, but not a safe way, is just to have a candle lit. And if it flickers, that's draft. But we know we don't want to do that in an environment such as a barn with a lot of combustible material like straw and hay. But if you can feel just the breeze on your cheek, lightly on your cheek, that is draft, and we need to minimize that for those newborn calves. 24 square feet of resting space, Dairy Calf Heifer Association, we have research up to 32 square feet. Looking at calf hutches or pens, usually they are 32 square feet of resting space. So again, that's resting space, and in a group housing facility that does not include where they're actually, whether it's their grain or their milk station, it's where they can actually lay down. The materials in your housing should promote optimum hygiene. In other words, we should be able to clean them easily, disinfect them easily, and not be a place to promote bacterial growth. And again, proper and adequate bedding so that calf can have an environment, if it chooses just to lay on top of the bedding, or be able to hunker down and be able to insulate itself, especially on the colder days like we had earlier this week. Ventilation is key with our newborn calves, and we need to look at an air exchange in the barn or the facility at least 4 times per hour. So every 15 minutes, the air in that barn should be removed and replaced with new air from outside. And we can do that by various ways, including natural ventilation, and that we see in some of our calf barns. We have positive pressure tubes that are placed in the barn to help direct air directly where the calf is at the ground level. What we have to remember about positive pressure tubes is that they're not meant to be heat abatement. They're a 3-season type management practice, especially when we have that stale, damp air in the spring and the fall to help move that air out away from those newborn calves. And just putting a tube in with a fan and a bunch of holes isn't really going to cut it. They do have to be measured because there is some physics to this. But even a barn over 100 feet in length actually needs 2 fans going, one pulling through, pushing through, and one pulling it to get it across the surface of the length of the barn. Or then you put in a second system at the other end as well, to coming in from different directions. But again, the positive pressure tubes, again, are just to bring that air, mix it up, stir it up, because a lot of times that stale air kind of sinks down to the calf level when she's laying down. We're trying to like move it up so that we can have air exchange, pushing it out the barn. We want to avoid the obstructive walls. So if we look at individual calf pens, the ideal Wisconsin calf pen where we have solid sides as well as an open front and back to make sure we have airflow and not creating a microenvironment. We also want to make sure that these walls are short, 2 feet. We've seen some as high as 4, but that does block with ventilation. So 2 feet, so at least something that we can buck up against to clean out the bedding, but yet low enough so that we can get airflow to where it's most needed. Positioning our barns and thinking about ventilation, avoid permanent wind shadows when it comes to trees or other buildings. Seasonally, we can have it from trees as well as fields, like cornfields can provide wind shadows. So a minimum 100 feet away from potential wind shadows is key in placement of the barns. Dr. Terry Olivet had presented this at the AABP annual meeting back in 2019. And we want to manage curtains properly, especially when we have these types of open, natural ventilated calf barns for group housing. And really want to maintain those curtains in a way that they're closed at 40 degrees or less when it's colder outside, and to manage the eaves and the ridge openings to maintain the ventilation. 40, as you know, newborn calves are cold stress at 50 degrees, and our 1-month-old calves are cold stress at 32. So at 40 degrees, we definitely want to make sure those curtains are up and managing the ventilation through eaves and the ridge openings. Also, she recommends that adding flexibility with the split curtains so that when the weather permits, we do want to open them, but want to avoid having rain or the sun, radiant heat coming in, to use the split curtains to give you a flexibility in managing the ventilation as well as some of the environmental conditions those young calves can face. And really, we want to manage those calf barns cold. It's cold housing. They're only a few degrees warmer potentially than the outside environment. We want to manage them as cold barns. So if we can leave those curtains open as long as we can for fresh air, that is key to keeping those calves healthy, especially in cold weather. But again, recognizing where is that fine threshold for your facility, as well as nutrition and bedding is key in managing those curtains and whether to let them stay open longer during colder weather, or maybe even open on a day like this when it's 37, but it's still kind of damp out. But again, proper nutrition and bedding could be also a key thing in managing those curtains as well. Finally, just a couple slides on disbudding considerations. We've heard quite a bit of this here in the state of Wisconsin and across the United States, and it's pretty much here to stay. So I don't want to dwell on this too much, but disbudding is key. We see that as part of the National Dairy Farm 4.0 program, and that when it comes to disbudding, we need pain mitigation for disbudding, and that needs to be provided. And that criteria for the National Dairy Farm program comes from the AABP guidelines when it comes to pain management. And that pain management should be considered the standard of all care during dehorning and disbudding procedures. But you need to work with your veterinarian to develop the most appropriate type of management protocol for your operation. But again, based on a lot of research, what we know the calf is feeling, we are in a position to offer pain management for those newborn animals. But how can we incorporate them into the operation? Disbudding versus dehorning, I think that's really key when we're talking about that and the difference, and why when we look at the National Dairy Farm Program's 4.0 version, why we want to get them done at 8 weeks of age or younger. So disbudding is the destruction or excision of horn producing cells before the skull attachment. So when you're working with your newborn calves, you can kind of feel that little horn nub, but it's kind of loose or wiggles there a little bit. And as they get older, we can, over 8 weeks of age, becomes dehorning, because at that time, the horn producing cells and the horn attaches itself to the skull. And then it's that point where excision of horn and horn producing tissue after the skull attachment. So in this example here, Zen Miller, who was a former Outagamie County Extension agent, had these 2 calf skulls prepared for us as an example. Here's a younger calf. You can tell based on the size, a younger calf versus the older calf. And you can see in this area here, we really don't see any horn development here. Again, because at the time this poor calf met its demise, unfortunately, that horn did not attach to the skull, versus here's an older calf that over 8 weeks of age, and that horn nub actually starts attaching to the skull. So as you can see, this becomes more of a challenge, a difficult task to remove than if it was a disconnected horn bud here in this example. So that's why it's very important and recommended by the National Dairy Farm Program to have the animals disbudded, removing that horn producing cell before the skull attachment, rather than waiting when we get older. The calves are older. And I know labor is the issue. You try to do the calves all at one time and may not have able to group them, or time escapes you and we can't get them disbudded early enough. So we want to prevent pain during and after disbudding. That is huge. That's part of the National Dairy Farm Program, as well as a recommendation from AABP. And that includes both use of local anesthesia, like a lidocaine block, or numbing of that area, as well as pain management, generally through a non-steroidal anti-inflammatory drug. And in this picture here, we could see that what we're trying to do is put in a block here in this corneal nerve right above the eye, so that we can provide numbing here to be able to remove the calf, especially for doing cautery or hot ironing of removing that horn bud. But the key to remember with the anesthesia and the non-steroidal anti-inflammatory drugs is that we need to have a veterinary client-patient relationship with their veterinarian, especially with the non-steroidal anti-inflammatory drugs. A lot of them are used extra label, so you can only use those under the direction of a veterinarian, as well as the local anesthesia. Again, disbudded by 8 weeks of age, we can use caustic paste, which is easy to do right at the time they're born, up to 2 weeks of age. Pretty easy, part of your processing management tasks. Or if you're waiting till a little bit older, hot iron at 2 weeks or older. But again, it becomes more of a bigger task when they're older and hot ironing. Now, unfortunately, if they're over 8 weeks of age, it is considered a surgical procedure at this point in time, because we're removing the actual horn from the skull where it finally attached. And Dairy Farm 4.0 indicates that this is a mandatory corrective action plan if you're found on the farm calves over 8 weeks of age and dehorning them. And you have 9 months to correct this issue. Otherwise, the dairy license or the plant may say you're no longer should be able to ship to them for processing. So again, it's really coming down. I think we've had many years of encouragement of disbudding, and now it's actually got some consequences if we're waiting till calves are over 8 weeks of age, not only from a financial perspective, but also from a pain management perspective, animal welfare perspective. And the key is whatever your farm operation chooses, whether it's caustic paste or using hot iron, is to have standard operating procedures that includes pain management as well as a local anesthetic for those newborn calves. So just to go in for the last half hour, we talked, just kind of in generalities, getting a healthy start, looking at those calf health benchmarks and hygiene practices and benchmarks so that you can measure how well you're doing in your calf success, as well as housing considerations and disbudding for our newborn calves. And again, just to remind you that 2 heads are better than 1 as we're looking at a paired housing of our dairy calves or social housing, whether it's pairs or whether it's in a large group. And many of these fact sheets, as well as additional information regarding paired housing, can be found in Dr. Jennifer Van Oss's lab's website at animalwelfare.cals.wisc.edu, as well as not only calf housing, paired calf housing, but also many other things related to animal well-being.